Welcome to your pre-laboratory 2 screencast, which will cover the spinal cord, spinal nerves, and autonomic nervous system. Illustrations throughout the screencast come from Seeley's Anatomy and Physiology textbook, University of Michigan's BlueLink, Netter's Atlas of Anatomy, and other various anatomy textbooks and atlases. We'll first start off with the spinal cord. When we take a look at the spinal cord, it is segmented into a cervical, thoracic, lumbar, sacral, and coccygeal regions. These regions give rise to 31 pairs of spinal nerves, meaning that we have the spinal cord levels on both sides. Although we have the spinal cord in one elongated section, there are some changes in diameter throughout the length. First, in the cervical region, we see an enlargement due to supply to the upper limbs, which we can see in this region over here. And we also have the region more inferior, which is termed the lumbosacral enlargement. You will also have this described as the lumbar enlargement. It is still referring to the same segment of the spinal cord. So let's take a look at this as far as the different regions or segments. Here we have the cervical segment, and remember that this is an enlargement. We have our thoracic segment, which you see starting at rib number 1 and extending almost down to about 10th rib. And then more inferiorly, we have the lumbar segment, which spans pretty much from the regions where you would find ribs number 11 and 12. And and I forgot to mention that we have the sacral region, which is going to be almost at the very tip where we would expect to find the conus medullaris. So together here, the lumbar and sacral segments are the enlargement, the lumbosacral enlargement of the spinal cord. And lastly, we have the coccygeal segment, which is the very inferior portion of the spinal cord. Here's what you can expect for it to look like on a cadaver. We can see more superiorly is the cervical enlargement of the spinal cord, and then inferiorly, where you see it enlarged right before we see the conus medullaris, which I'll describe to you in just a moment, is your lumbosacral enlargement. Here's an inferior portion of the spinal cord that we see right in this region over here. At the very end, we see it coming to a cone shape or a point, and that would be termed your conus medullaris. This conus medullaris structure will be found in the region of L1 or L2. If you find the conus medullaris and look at the very tip of it, you will see a silver or white strand coursing inferiorly, and that is termed the filum terminale. Don't worry if it says internum or externum. That involves more detail. We're just going to know it as the filum terminale. And the other strands that we see surrounding the filum terminale, these are the lower mixed spinal nerves that collectively will be termed the cauda equina. Now, if we were to take that spinal cord and cut through so that we can have a cross section cutting through and in the transverse plane, to be specific, we are able to see the white matter along the periphery and the gray matter internally. And here's the vertebral body. So looking a bit closer here at that spinal cord cross section, if we look at this gray matter in here, we can identify the 3 different horns. The way you can identify whether you are looking at a dorsal horn or a ventral horn is to look for this vertebral body or look for extensions coming out representing your dorsal roots, which lead to your dorsal root ganglion. So once we are able to orientate ourselves, we can see the dorsal horn, where we will find the terminal ends of the sensory neuron. We can also see the lateral horn, which contains cell bodies of your autonomic nervous system motor neurons. And lastly, your ventral horn, which will contain the cell bodies of motor neurons. Beyond the spinal cord region, we can see extensions coming out from this posterior view, which would be your dorsal rootlets. The dorsal rootlets come together to create your dorsal root, which will then lead to your dorsal root ganglion. Remember that your dorsal rootlets and dorsal root contains your sensory neuron, whereas the dorsal root ganglion contains cell bodies of your sensory neurons. If you look on the ventral surface of the spinal cord, we would see that there would be ventral rootlets that are difficult to see here in this view. Those ventral rootlets would come together to create your ventral root, and both of those structures contain motor neurons. Once the ventral root and the dorsal root come together, it creates your mixed spinal nerve. In this image, you can also see the dorsal ramus and the ventral ramus, but I don't believe we have any cadavers in the lab that we are able to see this in. Now let's discuss the meninges of the spinal cord. These meninges are going to be the exact same from your brain structure lecture, but we will review them anyway since they will look a little bit different here. So this view is a posterior view of the spinal cord with the dura mater still in place. You can see that it is pigmented a bit more white, and we don't see any of those spinal veins that we saw in the previous images. Here's a bit more of a magnified view. You can see the dura mater here has been cut open, and we could see the cauda equina here. The dura mater in the lab will most likely be pinned laterally. If we cut the dura mater completely away from the spinal cord, we can see the other layers. We know that external to the dura mater, we would have your epidural space. This thick tissue here is your dura mater. So deep to that dura mater, we would have your subdural space, which remember is a potential space. We only have minimal amounts of serous fluid here. And deep to that would be your arachnoid mater, this spider web or saran wrap-like structure. Deep to the arachnoid mater, we would find your subarachnoid space, which would be filled with cerebrospinal fluid. And once we peel away this arachnoid mater, we are able to see the pia mater that is adhered to the spinal cord. And just so you're aware, these were the spinal veins that I was referring to in the previous slides. Another thing I want to mention here are these denticulate ligaments. These denticulate ligaments arise in the pia mater and are firmly attached to arachnoid mater and the dura mater at the apex. And what their purpose is to divide the dorsal rootlets from the ventral rootlets. Here's a little bit better look and some more examples of what these denticulate ligaments look like. Denticulate refers to tooth, so anatomists thought this looked like a tooth extending out and attaching to the dura mater. Now let's discuss the spinal nerves. We'll start off with our cervical plexus. Our cervical plexus has two nerves that you are responsible for. First is the phrenic nerve, which we've already seen in the lab. You will find this anterior to the root of the lung. But for most of you, or the cadavers that you are looking at, the lungs have been removed and most likely the heart as well. So you will find this string dangling in the thoracic cavity, and the way you're going to know this is the phrenic nerve is that it will be extending down to the diaphragm in order to give innervation here. Next we have your ansa cervicalis. The ansa cervicalis is a loop of nerves that are, of course, a part of our cervical plexus. And the region that you would search this nerve for is going to be anterior to your common carotid artery and your internal jugular vein. Sitting in between these two vessels is your vagus nerve. And together, these three structures are surrounded by a carotid sheath. So the ansa cervicalis will be found external to that carotid sheath and will form the loop outlined by my arrow here. Now let's move into the brachial plexus. I like this image because it really depicts the brachial plexus coming from the ventral rami of C5, C6, C7, C8, and T1, and how it forms three different trunks. You are not responsible for the trunks of the brachial plexus in the lab, but you should have an understanding that these plexi are interwebbings of nerves. So moving beyond the trunks, we would have those anterior and posterior divisions, and finally reach the three cords that you are responsible for knowing in the cadaver lab. First, we have your medial cord, which if we follow back would go to your ventral rami C8 and T1. In the middle here, we have your posterior cord, and if we follow that back, we know it comes from the ventral rami C5 to T1. And lastly, your lateral cord comes from the ventral rami of C5 to C7. So now let's look to see how these cords branch into the terminal nerves that you're responsible for. First, we have your radial nerve. And if we follow the posterior cord here that you see in the purple, extending out from there will be your radial nerve. This radial nerve will travel posteriorly. So the other area in which you can see the radial nerve well is here in the area of the triceps brachii muscle. So this is a posterior view of the arm, and you would find the radial nerve between the lateral head and the medial head of the triceps brachii muscle. The radial nerve will then extend into the forearm and branch into a superficial branch that will give more cutaneous supply, and a deep branch that will continue to supply posterior forearm muscles. Next, we have your axillary nerve, and this too comes off of the posterior cord seen in purple here. So in the light pink, we see your axillary nerve. The axillary nerve is responsible for supplying two muscles. One, in this posterior view that we can see, is your deltoid muscle, and the other is your teres minor, which we see here outlined by my arrow. Here's another view where the deltoid has been pulled away. This is a posterior view, and you could see the axillary nerve branching out to give supply. Next, we have your median nerve, and the median nerve is very unique in that it comes from both the medial cord and the lateral cord. We have two branches extending off of those cords. These would be the lateral root of the median nerve and the medial root of the median nerve. When those roots come together, they create in pink this median nerve. The median nerve does not do anything within the arm portion, but as it heads down into the forearm, it courses deep to your flexor digitorum superficialis muscle, courses deep to your carpal tunnel, and extends into the hand to give supply to some of our hand muscles and also cutaneous supply. Next, we'll discuss the ulnar nerve. Here you could see your medial cord, and branching off of the medial cord in pink is your ulnar nerve. Just like the median nerve, the ulnar nerve does not supply anything within the arm, but once it heads into the forearm deep to the flexor carpi ulnaris muscle, it extends down outside of the carpal tunnel to give supply to most of the hand muscles. It also gives supply to some forearm muscles in the anterior compartment, and this nerve is special. If you remember from Anatomy and Physiology 1, this nerve courses posterior to your medial epicondyle of the humerus in the region that we call the groove for the ulnar nerve. And our last terminal branch of the brachial plexus is your musculocutaneous nerve. You can see the lateral cord here, and in pink is the musculocutaneous nerve. Here it is extending laterally to 88% of the time pierce the coracobrachialis muscle. Here's another view of that musculocutaneous nerve extending over to the coracobrachialis muscle. Here, the musculocutaneous nerve supplies all of the anterior arm muscles, and then as it extends into the forearm region, it actually changes its name to that lateral antebrachial cutaneous nerve in order to give supply to the lateral forearm. And here's a view of that, what I like to call LAC branch, lateral antebrachial cutaneous nerve. No, you do not have to know this terminal branch name of the musculocutaneous nerve. So once we've moved past the plexi, we can see in the thoracic region that those ventral rami are going to extend on out to give branch to intercostal nerves that I have the yellow orangish arrows going to. The way you're going to make sure that you know that these structures are nerves and not blood vessels is to remember that the vein is always going to be the most superior, artery is intermediate, and the nerve is the most inferior. So the way I like to remember this is the van drives down the hill, meaning the V for vein, A for artery, and N for nerve are moving from superior to inferior, VAN. So here we have another example. Here's our vein, the intercostal artery, and the intercostal nerve. Next, let's talk about the lumbosacral plexus. Within the lumbar plexus, we have two main nerves that we have to know, and that is the femoral nerve and the obturator nerve. Pictured here is our femoral triangle. To refresh your memory, the femoral triangle is made up of three borders. This is your medial side, lateral side, and of course this is superior and inferior. So to review the borders, you have your inguinal ligament, which has been cut out of the way, but you can imagine it is where my arrow is coursing. Then you have your adductor longus as your other border, and your lateral border would be your sartorius muscle, which has been cut, but it would extend down this way. And so you can now see an imaginary triangle in this region. And within our triangle, we have your femoral vein, femoral artery, and femoral nerve. So the femoral nerve is the most lateral. And another way that I like to remember the order of the blood vessels and nerve is to remember in this area, the van drives up the hill. So V serving for the femoral vein, A for the femoral artery, and N for the femoral nerve. The van driving up the hill, starting medially, moving laterally. And here we can see the obturator nerve. Obturator nerve courses through the obturator foramen, and here we can see it lying external or superficial to your adductor brevis, coursing down to give supply to the medial thigh muscles. Now let's look at some of the branches from your sacral plexus. We have your sciatic nerve here, and the best way to find this is to look at a posterior view of the thigh and the gluteal region, which is what we're looking at. And once we move away the gluteal muscles, specifically gluteus maximus, we are able to see this small muscle called the piriformis, which means pear-shaped. So you can kind of see the pear shape of this muscle here. And if you look inferior to this muscle, you should see 88% of the time the sciatic nerve coursing inferiorly. So here's our sciatic nerve. It is the largest nerve in our body. And the sciatic nerve is actually made up of a tibial and common fibular nerve that are surrounded by a common epineurium. Once we follow the sciatic nerve inferiorly, so you can kind of draw a schematic in your notes here if you'd like. Here's our sciatic nerve coursing down the posterior thigh. And once we get to the posterior knee, termed the popliteal region, it divides or bifurcates into your tibial nerve and common fibular nerve. So you would draw another line down as your tibial nerve and another line moving laterally, that would be your common fibular nerve. You may have also heard this called the common peroneal nerve. Peroneal is an older term, whereas fibular is a newer term, but you should know both as both are used in practice. From there, your tibial nerve will continue down along the leg, and once it reaches the foot, it will divide into a medial and lateral plantar nerve. So this is a inferior view of the foot. Here at the number 8, we can see the medial plantar nerve, and alongside it is the medial plantar artery. At the number 9, you could see the lateral plantar nerve, and alongside it is the lateral plantar artery. If we go back to that common fibular nerve, it is going to bifurcate into a deep and superficial fibular nerve. So in order to find the deep fibular nerve, we are going to look at the anterior leg compartment. So to get a better idea of how these nerves course, I want you to imagine the popliteal fossa behind the knee here. That common fibular nerve that came off of the sciatic nerve wraps itself around the head of the fibula that would be in the region of my arrow. From there, it is going to bifurcate into this deep fibular nerve. The deep fibular nerve courses alongside the anterior tibial artery, and we could find this lateral to the tibialis anterior muscle that has been dissected away here. So in your schematic, you can add this line and label it deep fibular nerve. Now to find the superficial fibular nerve, we need to look at a lateral compartment of the leg, and you can find deep to the fibularis longus the superficial fibular nerve. So in our schematic, we can add superficial fibular nerve. Now, you may have already guessed this, but the deep fibular nerve will supply the anterior compartment of the leg, and the superficial fibular nerve will supply the lateral compartment of the leg. And the way I always remember this is by thinking of how superficial people stand. And that's usually with their leg laterally. So this helps me remember superficial fibular nerve supplies lateral leg. People who are deep thinkers stand with their feet together, pointed anteriorly. And so I think deep fibular nerve supplies the anterior compartment of the leg. Now let's move into the autonomic nervous system. The region where we will see our sympathetic chain ganglia will be in our posterior mediastinum. And so here you can see along the vertebral column are the thoracic sympathetic trunks. Now if we look at a closer view here, you could see those thoracic sympathetic trunks, and in between the trunks we have these round thoracic ganglia. We can also call these autonomic ganglia or sympathetic ganglia. Extending from the sympathetic chain, we can see these tiny branches laterally. These are called your white and gray rami communicantes. In lab, you will not have to differentiate between the white and the gray, but you should know that the white rami communicantes will more commonly have the preganglionic neuron within it, whereas the gray rami communicantes will more commonly have the postganglionic neurons within them. And this is just another great view of the ganglia and the thoracic sympathetic trunk between them. The last thing we are going to discuss is splanchnic nerves. This specific one is the greater splanchnic nerve, and these will extend out medially from our sympathetic chain ganglia, and we will discuss the pathways of neurons through these splanchnic nerves in our lecture portion of the autonomic nervous system. That is it for our pre-laboratory 2, and I will see you in lab.